Letitia, Infection Control Officer, Mamata Academy of Medical Sciences, Bachpally, Hyderabad. Today, we will know the rational usage of mask in general public. As an ICO, like as an Infection Control Officer, we are very much interested to teach you when to use the mask and how to use the mask to prevent irrational usage of mask. Everywhere we are seeing people are wearing masks and people are insisting to wear a mask. But it's more than important that if you wear a mask, you need to maintain a social distance as well as hand hygiene. All the three together can bring you down the exposure to COVID-19 pandemic. So all together will work better than a single approach. So the mask. There are different types of masks available in the market. That is the N95 mask, the surgical mask and the cloth mask. N95 and the surgical mask are generally preserved for the healthcare workers. Why? Because there is a lot of scarcity for these masks, and most of the time the aerosol generating procedures and the healthcare workers are continuously exposed to the COVID-19 positive patients or the suspected cases. So they need more of these surgical masks and the N95 mask. Now, this is the surgical mask which is available. Now, when to use this surgical mask? And in a general public, normally a healthy individual no need to wear this type of mask at all. But in case if the person is feeling cold, cough is there, if they are having cold, cough, fever or any other symptom like difficulty in breathing, then they need to wear such a mask. Or if the person is giving care to a patient who is COVID-19 positive, then they need to wear a mask. So this is the rational usage of mask. Other than that, you don't need to wear a mask at all. Now, let's see what is the cloth mask. Now, this is a cloth mask. This is available now. They don't have a frill, of course, but this is a cloth mask which is available. Now, what is the protection of this cloth mask? This will not protect you against the virus, but it may give you a 50% protection against few bacteria, pollen and dust. Now, this mask in this COVID-19 pandemic will give you a false belief that you are protected against the virus, but if it is along with social distancing and hand hygiene, it may give some type of protection. Now, this cloth mask, if you are not using properly, then you may land up in infection instead. So, if you are using any mask, you should know how to use it and how to dispose it. Now, let me show you how to use a mask. You need to wash your hands with soap and water, or you can use a hand rub. Now, in the next video, we will show you how to use a hand rub and how to use your soap and water. Now, before that, we will show you how to use a mask. First, you perform a hand hygiene, then inspect the mask. The front side of the mask and the back side of the mask, if there are any tears in the mask. Now, you should see, now this mask is frilled. Okay, this mask is frilled. Now, frilled mask, I will show you the surgical mask. This is the surgical mask. Here you can see the frill which is falling down. This is meant for when the droplets of the opposite person, when they fall on it, they just slide on this frill. And the inside of the frill, you can see the pockets. Now, these are the pockets. In these pockets, when we talk, this is the inside of the mask, when we talk, our droplets will fall in this pocket. And you should never touch the outside of the mask and the inside of the mask before wearing it. And this is how you need to wear a mask. Now, I will show you how to wear a cloth mask because it is recommended for general public and surgical mask is not recommended for general public. Now, this is the cloth mask. Never touch inside and outside. First, tie the upper threads, then the lower threads. So once the mask is fit, it should be snuggled properly. It should cover your nose, mouth and your chin. This is a complete procedure and complete correct way of wearing a mask. And you should talk less when you are wearing a mask. So how to remove a mask? And never touch outside of the mask because the droplets from the other person fall onto your mask, and never touch the inside of the mask. Now, how to remove the mask? First, you need to remove the lower threads. You need to remove the lower threads. Suppose if you remove the upper threads, your mask will fall down, and whatever the aerosols or the droplets on the mask will stick to your dress. So first you need to remove the lower threads and the upper threads. Then hold the mask with the threads together. Never touch the mask outer and inside, and dispose it in closed bin, which is kept for this mask disposal. So this is how you discard the mask, and you should never throw it in the open air and in an open dustbin. So it should always be kept in a closed dustbin, and it is always kept properly. It should cover the entire face, and it is not recommended to dangle the mask around your neck. Like many people do this, they dangle the mask around the neck while eating. They just pull it down, and that is not recommended at all. It is instead, it is most hazardous. See, whatever the droplets which are there on the outer side of the mask will stick to your dress, and perhaps you will inhale, you may inhale it, and again you may get infection. So you should avoid dangling it around the neck, and you should always dispose it properly. And this is the rational usage of mask. So kindly preserve the N95 mask and the surgical mask for the healthcare workers and all the general public. We do recommend the cloth mask, which is for your safety, along with social distancing as well as the hand hygiene. With this, we sign off. Next video will explain you how to perform a hand hygiene. Thank you so much.